Hello.
Ladies and gentlemen, distinguished panelists, and my esteemed viewers, a very warm welcome to this insightful session in celebration of the Nutrition Week. I am Dr. Nishant Sharma from Voice of Healthcare, and I am honored to be the moderator for this enriching discussion. Voice of Healthcare, in collaboration with Esperer Nutrition, is here to mark the occasion of Nutrition Week as we recognize the paramount importance of nutrition, particularly in the context of cancer care. Cancer, a very complex and a challenging journey, not only impacts the body's physical well being but also has profound implications on nutrition and the overall quality of life. Today, we have assembled a very distinguished panel of experts bringing a unique perspective to the table from each one of them. We have with us renowned oncologists, starting with Dr. Shishir Shetty. Good evening, Dr. Shishir. Thank you
Good
for
evening.
joining us. We have Dr. Rajpal Singh. Good evening, Doctor. Thank you for joining. And we have Dr. Tushar Jadhav with us joining. Good evening, Dr. Tushar. Thank you for
Hello,
joining.
hi, good evening.
All of these oncologists have spent and dedicated their entire lives and careers to understanding and treating cancer. Joining with them, we have Ms. Varsha Gorey, a provincial dietitian and a nutritionist whose practical insights have changed patients' life. Good evening, Ms. Varsha. Thank you for joining.
Thank you.
Yes. So our panel today will delve into the crucial phases of cancer care while representing the intricate dance between medical sciences and the nutritional support, while collaborating amongst medical professionals and caregivers. And we understand that this is an essential role in improving the patient outcomes. So during today's session, we will be talking about each phase of an oncology treatment, let it be the preconditioning phase, the during treatment phase, or how nutrition also holds an important part in the post treatment phase. And as we navigate through these discussions, I encourage my esteemed panelists to share their expertise, their insights, and their experiences to have an active engagement with questions and answers and exchange of knowledge. Together, let's embark on this journey of understanding the pivotal role that cancer plays, aiming to illuminate all the new perspective, challenging the misconceptions, and ultimately contributing to a great public awareness. So, without further ado, let's commemorate and let's commence this enlightening discussion, and let's stand at the crossroads of medical science and the art of nourishment. So my first question will be an open question to each one here. I'll start with Dr. Shetty. This is a very broad question, and I would want you to give an answer to that. In your respective role, how do you feel is the intersection of nutrition and cancer treatment, and why is it so crucial for the patients? Over to you, Dr. Shetty.
You see, if you look at some of the signs that we talk about cancer, apart from breast cancer, but most of the cancer is associated with nutritional deficiency. Weight loss is one of the chief complaints that we try to elicit. More so if we talk about any obstructive type of disease, say esophageal, stomach, head and neck cancers. So the nutritional challenge that we face in most of the GI cancers is great, and probably one of the first bases on which we try to assess and try to correct before the surgery, which gives obviously a better outcome for these patients. As a surgeon, I think it's paramount for us that we assess this, and we face this on a daily basis. Most of them, I think 90% of them would be nutritionally challenged. And
Right, right.
other than that, if you look at just because a person is obese or heavyweight, it does not mean he's not nutritionally challenged. That's a misconception. All right, the patient may be looking healthy, but definitely challenged. So yes, my other panelists will definitely agree with me on this. But please go ahead with the
Yes.
question.
Thank you. Thank you for your answer, Dr. Shetty. Moving over to Dr. Rajpal, the same question, the same opening question to you. In your view, how do you view the intersection of nutrition and cancer treatment? And what are your views on the cruciality of it in the treatment outcomes? So you're not audible. Uh, we aren't able to hear you.
As
Yes,
can
you're
you hear me?
audible now. You're audible now. Yes.
Sir, as sir actually said that they both go hand in hand. Treatment is equally important, and nutrition is also very much important. Since we are in a developing country, India is a developing country, and we came across patients with different strata of build. So we came across patients who are heavily built. We came across patients who are thin build. So we need to pre-assess every patient. So it is not fit for all strategy. It is individualized for every patient. Moreover, duration it will go from 6 months to 1 year, and for palliative patients till they are they are alive. So we need to uh, plan their nutrition as per they can take the treatment and sustain all the oncological managements till they are alive.
Right. Thank you. Thank you for the answer, Dr. Singh. Moving over to Dr. Jadhav, your views on the intersection between nutrition and cancer and the importance that you feel it holds.
Yeah, actually, many deficiencies can lead to actually one of the etiological factors, even as Dr. Shetty sir has said already. But now new researchers have coming up that vitamin D deficiency is associated with breast cancer. So definitely the deficiencies play a major role as a causative factor. Plus, the cancer patients, because of the chronic malnutrition during the therapy, during surgery, during chemotherapy, and even during radiation therapy, they have a chronic malnutrition, and that's why goal of the treatment there is a cascade basically. If you are having malnutrition, the deficiencies again the side effects of chemotherapies and radiation therapy happens. And this is a long-term process, long-term treatment, and that's why the nutrition is very important throughout this throughout the journey, so
Okay,
that they
moving
can
over to
sustain
Miss.
goal treatment. Yeah.
Yeah, moving over to Miss Varsha here. Let's talk. Let's hear from a nutritionist's point of view the intersection between nutrition and cancer care. Ma'am, over to you.
Thank you so much. When I'm in the online session with three doctors and one clinical dietitian, that itself says yes, nutrition has a small or big role because food is the basic necessity of life, but and everyone likes to eat. We'll have a lot of discussion, but to just how to have an intersection with the onco patients, it is I think of ABCD. I used to think of ABCD. Now I've expanded to E and F. So the anthropometrics, the biochemical parameters, the clinical conditions, complaints the patients have, like dysphagia hai, khane ko nahi hota, abdominal issues, obstructions, fatigue, weight loss, all whatever the complaints are, the major diagnosis. This is definitely an intersection with the oncotherapy, whether they're taking a therapy treatment different any modalities. And lately, I've also added two more components, the E and the F, the emotions. That plays a great role because people are anxious, they don't feel like eating, family pressures. So, and F, the finance comes into mind because it's just not a disease like it's like not like a CABG you've gone and it's over with it. So it does play an important role, and we will take it ahead as we move with more questions.
Yes. I think a very nice introduction for the panel by each one of my panelists here. So I think we'll move on to the main segment, the main interviews, the main questions that we will be discussing. I'll start with Dr. Jadhav. So this question is for you. When developing treatment plans, how do you take into account a patient's nutritional status and need? And are there any specific types of cancer or treatment that require some specific attention in this regard? Over to you, Dr. Jadhav.
Yeah, basically, we involve from day one. We involve nutritionists with the management plan basically. Now, as far as the surgery is concerned, because being a surgical oncologist, I will be more handling patients pre-operative and post-operative. So, and basically the breast and head neck specialist, actually especially in head neck patients, it is a challenge to maintain the calorie and the protein intake immediately after surgery. Everything goes through the Riles tube. And even in breast, though it is not such a morbid condition, that is post-operative morbidity is not there in breast patients, but still the nutrition plays a role for the recovery, basically. So if there is a longer surgeries, I usually prefer the glutamine supplements on 24 hours before the surgical interventions, and even one day for continuous 3 days. Even if there is a breast reconstruction, we prefer glutamine supplements for day 1, day 2, and day 3. And for head neck, immediate first 3 days will be having a high calorie intake, high protein, and that will be taken care by the kilo, actually body weight and the total nutritional values of biochemical analysis. So
Right.
roughly around 50 calories per kilocalories per kilogram for the day 1, 2, and 3, and around 2 grams per kilogram for day 1, 2, and 3.
Thank you, Dr. Tushar, for
Yeah.
that very crucial answer. Moving over to Dr. Rajpal now. My next question is going to be for Dr. Singh. I want you to give your views on the focus of the psychological aspect of nutrition in cancer care, and how do you address the emotional and the mental well-being of patients, which can, significantly change their dietary choices and adhere for them to be in the nutritional plan. Over to you, Dr. Singh.
It is actually a very difficult task, and
So your
all
voice
these
is breaking. If you can maybe pick up your phone, it was better that way.
it is actually a difficult task to do alone. So we usually take help of our counselor also and dietitian also. Since we know that 30% of the patient in radiation oncology OPD comes from head and neck side. So there, as Dr. Jadhav rightly said, the management of nutrition is utmost important, because with after surgery or patient going for definitive concurrent chemo radiation, with passage of time there is increase in mucositis, there is increase in toxicity, and there is decrease in intake. So we need to actually address the nutrition of the patient upfront. We usually counsel these patients that you have to take extra calories in first 15 fractions of your treatment if we're going for a definitive CTRT or adjuvant CTRT. So we tell them to take a good amount of calorie, extra amount of calorie in starting phase of the radiation, because as we go beyond 15 to 20 fraction, the severity of mucositis increases, and there is decrease in intake of patient, which actually don't have Riles tube placed during, or we are taking those patients for definitive CTRT. Moreover, the psychology of nutrition in these patients varies from how what are their personal preferences for the nutrition. Like there are certain people who don't want to have a non-vegetarian diet. There are certain people who require vegetarian diet, or there is they like some other sort of diet which they want to incorporate. So we need to counsel them accordingly, as per their demands, as per their requirements, and plan their nutrition as per their requirement and whatever they are required for continuing the treatment.
Right, right. Like we say that India is a country of varied tastes. So I think nutrition in cancer care will also hold true. What are your views on that, Dr. Singh? Uh,
Yes. This is a country of different food, different ethnicity. So we need to incorporate that thought also in our planning process, and
mhm.
eventually we need to plan their diet according to these factors also.
Thank you, Dr. Singh, for your insightful answer. Moving over to Dr. Shetty, my next question is going to be for you. You being an oncologist, you've seen the direct impact of cancer treatment on patients. I want you to share some common nutritional challenges that you have seen patients face during their treatment, and how do these challenges basically influence the outcomes that you would have expected? Over to you.
So, very frankly, it's an established fact that if you are most of our patients, say if you operate on a CA esophagus, we know now that most of our patients that CA esophagus are nutritionally challenged because that is how they are first detected by difficulty in swallowing and loss of weight. So, one of the most common things. Now, in these patients, if you improve their nutrition before surgery, the outcomes are better.
Mhm.
Now, this is a known thing. Multiple RCTs publications have been are in place. So, this is already proved. Now, the problem sometimes happens is depending on the flavor of the year, people want to introduce different type of things, whether it is fish oil, non-fish oil based, there are lots of proteins. I started remembering the content and the origin of protein has become a challenge. Fancy things, fancy sources. So these are some of the problems that we face. But the fact remains is that the outcomes are always better in a nutritionally and a physically fit patient.
Mhm.
Both go hand in hand. So where we work on the nutrition pre-operatively, intraoperatively, and post-operatively is important. Narcopenia, which is most commonly seen after the age of 40, and after the age of 40 is the most common age group. Now you have some patients who have complications. Then these are the patients who will do delayed rapidly. Just nutritional correction may not be enough. You need to add some element of or a major element of physiotherapy so that their muscles are contracted to get a better outcome. And definitely, whether it is macro or micronutrient correction which is needed is paramount, and proteins being the major play in this. So the combination of the protein, macro and micronutrients is going to change, which actually change the way we treat patients over the years. You see, when the first surgeries were done 50 years back or 100 years back, when the first surgery, the changes which has happened is anesthesia, blood products, better intensive care, and better nutritional care. Otherwise, the way we do the surgery has changed from open to lap and robotic. But otherwise, technically, most of the surgeries are still the same. So these challenges have changed the outcomes. That is why we talk about less than 5% complications in many of the cases.
Right, right. Thank you, Shetty, for Dr. Shetty, for your insightful answer. Moving over to Miss Varsha. Uh, from your perspective as a nutritionist and a dietitian, what do you feel are the key elements of a cancer patient's diet and the special attention that nutrition requires during the treatment? And are there any specific nutrients or food groups that you feel are very particularly important? Over to you.
Okay. Your long question, I'll try to segregate into three elements and I'll take some clues from the previous doctors who have said. So when we plan diet, the diet is not going to be same. It is going to be monitored and it's going to be modified. Like Dr. Tushar said that, during the first few days, you need a high calorie protein, then the role of supplements. Dr. Shetty did say that we need macronutrients. So, from my perspective, if you're talking about the key elements, I would like to focus on two aspects. One is the consistency of diet. Like, as per the doctor's advice, we plan the consistency of diet, whether we get oral diet, whether we have to manage with liquid diets or the tube feed, along with any other diet, or could be a parental nutrition in certain small number percent of cases. But the major element, irrespective of whatever type of diet you're doing, is the planning of macronutrients and the micronutrients. When we talk about the macronutrients, it's the carbohydrate, fats, and proteins. And here, most of our patients, whether it is obese or underweight, yes, in BMI is very important. But what is also important is that how much percentage are you distributing in carbohydrates, fats, and proteins? Fats have a better picture over here because fats are easy source of energy, calorie dense. So even if your patient is going to eat a smaller amount, it is good to provide with calories from fat. Now it depends. If you get that you want to feed the patient with fats, MCTs or medium chain triglyceride is one of the food group or the element which needs to be in patient's diet, because they are going to add to the calories, which you get in coconut oil. You get the nut base, so these are your fat calories. Then we talk about good quality proteins. Now there are a number of quality of proteins. We talk about whey proteins. We talk about vegetable proteins. So like Dr. Rajpal said, yes, there will be a community who will not talk about milk or milk based proteins. But planning of proteins, putting up requirement, yes, you require about 1.3 to 2 or 2, for a particular patient is very important. Now, how are we going to plan proteins? Is like a patient who was 80 kilos has come down to 60. He lost 20 kilos of weight and he has come to us from some small remote place and we want to build up. Suddenly, I cannot do it like a 2 grams. We have to start with 1 gram. We have to monitor over the week, add a formula which will give him more of calories, proteins, check for the tolerance, and then give it. So macronutrient, next comes your micronutrients. So when you're talking about micronutrients, the essential elements are based on your biochemical parameters. So definitely you want to improvise on the body protein sources. Then you want to look at the glutamine supplementation, because if the patient is for radiation therapy, is going to have mucositis in his mid phase of his cycle. There are certain special nutrients. There are certain ways of preconditioning before the chemotherapy. There is addition, and most important is hydration also, because most of the time they're taking so many medicines. Hydration is an important factor. So along with food, you also have to manage with the fluids of the patient. So all in all, macronutrients, micronutrients, antioxidants, because your immune system is compromised, inflammatory markers, that is आपके CRP levels or inflammation. Because in cancer there is going to be an inflammation. There are going to be rise in your inflammatory markers. So definitely we add good amount of antioxidant. Omega-3 fatty acids is one of the most. Then our household, what we talk it is like it can be curcumin, which is another highly rated kind of an antioxidant, and then I have many more to add on. So
No, thank
let's.
you. Thank you for a very specific and a very directed answer. I appreciate. Moving on to Dr. Jadhav now. Uh, Talking about the during treatment phase, talking about the during cancer treatment phase, I would want to talk about knowing that cancer treatment is often causing side effects that obviously affects a patient's ability to eat well. So I would want you to shed some light on the strategies that you recommend to mitigate these side effects and obviously then being able to maintain a proper nutritional well-being of a patient. Over to you, Dr. Jadhav.
Yeah, see, immediate post-op phase, whenever there is, for example, head neck surgeries, we usually put a tube feeds because they will not be able to deglute basically because of the flaps and suture lines. So that tube feed actually continues almost for a month, and the phases of the tube feed changes. That is, whenever he is in the hospital, it will be just a formula feeds. Then he goes to the home, then kitchen feed mixed with the supplements. But overall, we should maintain throughout that period, even if it is a tube feeding, we should maintain whole of the micro and macronutrients as Dr. Varsha was saying about it. Now, this is for just for the surgical phase, but what is important also is in a chemo phase. So chemotherapy induces nausea basically, and also the kind of dislike to the food. And because of that, the intake actually goes down. If someone is taking 2.5 to 3 liters of food per day, it goes down to almost 1.5 liters per day. She just is not hungry, or lady or a patient, and or even if she is hungry, she is not able to because of the imperative of taste sensations and all, and nausea and acidity. So overall, even if she is not taking that much of intake, whatever she is having, it should be supplemented properly so that that nutritional deficits will not be occurring. So that whatever she is eating in 2.5 liters, she should have those calories and those nutrients in 1.5 liters. So here it's very important to actually give supplements and add supplements into the regular foods. So, and during radiation therapy, same, especially the antioxidants and vitamin C supplements are again important during radiation therapy. So overall, for the nerve regenerations, for your antifibrotic activities, immune boosters, we need all those supplements in a proper way and proper quantity throughout the
Right.
cycle.
So these supplements will then obviously mitigate the side effects to a
Right.
lesser capacity and obviously promote the patient's well-being. A very, very, very insightful answer, Dr. Jadhav. Thank you. Moving over to Dr. Rajpal. My question for you would be, can you provide some insights into how nutritional strategies might differ for a cancer survivor who has completed their treatment and is looking to regain his life's normalcy, his health, and vitality? Over to you, doctor.
So, nutrition in cancer is being divided into active phase and later on into a passive phase or a build-up phase. So, when we are treating patient, when a patient is undergoing oncological treatment, like Dr. Jadhav said, for we have taken this patient for surgery, then followed by an adjuvant treatment in chemo or radiation. So, these patients require an active extra calories to sustain that treatment, to continue that treatment, to finish that treatment. But even afterward, when the patient has completed his treatment, the game changes for the build up. So here we require those things which will build up your body, which will fuel your body with energy, so that you can take care of yourself. Slowly, you can take care of yourself. You can add physical movement in your daily life. You can take care of yourself by your own self. So there we need to increase calories in later half of after completion of treatment. Like if there are strategies to increase the weight. Like if you want to gain 1 lb weight in a week, we need to increase 250 calories per day. And if you want to increase 1 lb in 1 week, we need to increase 500 calories per day. Sorry, if you want to increase uh, 1 lb in 2 weeks, we need to take extra 250 calories per day in the body. Moreover, the inclusion of a Mediterranean diet, like having more of green leafy vegetable, fruits, lesser of poultry, and very less of red meat, will also lead to better quality of life in these oncological patients. We need to stop smoking. We need to tell patient to stop smoking or quit smoking, and moreover, decrease alcohol intake, increase its physical activity, and moreover, we also need to include antioxidants and folic acid or supplements also in these phases, so that there is because this is a build up phase. Moreover, like Dr. Jadhav said, I am in contrary to his statement. I want to tell that we are not during radiation therapy, we are not prescribing any antioxidants, because with radiation we are generating antioxidants to treat free radicals, to treat the patient, patient with radiation. So by giving those antioxidants and by giving those supplements, we are decreasing the effect of radiation therapy in those patients. So these needs to be started post treatment, after completion of the treatment, so that it has more of a beneficial effect on the for the oncological outcomes.
Okay. Thank you, Dr. Singh, for your insightful answer. My next question is going to be Dr. Shetty. Dr. Shetty, are you there? Available?
Yeah, yeah, I'm there.
Yes. Hi. So my question for you will be, as we have understood and we have put this fact to be a very well established thing, that collaboration is key in cancer care. I would want you to give some examples where you have worked closely with nutritionists and dietitians, and you have ensured that the patient is getting their adequate nutritional support during the treatment. So how do you do it, and an example from your side?
Well, you should ask Varsha how I harass her. I exercise to
I
harass
will
her
add
for
definitely. I'll
where I
definitely add.
used to practically be after a Shetty post-operative pre-ops, and I had certain reservation about some elements which are there, because I would not agree with glutamine, role of glutamine. So yeah, every doctor has its own this thing. But I think finally when you work together, you kind of understand, and when we place patients' interest first, it becomes a good team. And we used to run a very good team in Apollo. Where I was in Apollo, we used to run a good team of people in the intensive care. Didactic, interested people with very specific concerns. So yes, it definitely helps. We have had patients, I think one or two patients, bad esophageal leaks which we have managed, colonic leaks which we have managed, because that's the time they need a very high nutritional support. Uh, and yes, I think results, definitely it is the team which takes the credit for that. And working together makes a lot of sense in getting better outcomes.
Thank you, Dr. Shetty. So now moving to Ms. Varsha, building on the question that I spoke with Dr. Shetty about, collaboration is the key. So you being a nutritionist, obviously your collaborations with oncologists is very crucial for cancer care. So could you share some successful examples of how the nutritional recommendation by a nutritionist had a positive impact on the patient's cancer treatment experience and the outcome that we saw?
Yeah. There are multiple examples, but I would definitely like to appreciate what Dr. Shetty sir said, that it's a collaborative effort. Like once the patient is planned for a surgery, and it is an elective surgery, you know he's going to undergo buccal mucosa, head and neck surgeries, and we have to counsel patient that there is going to be a tube and the intake is going to be further drop down, because then you need to feed in the tube. So first and foremost, the counseling part is taken by the dietitian, who will explain that you are going to go into these phases. You're not able to eat, in simple words. So you will be putting a tube by which we will be fulfilling the gap. Second thing is you cannot lose on weight. Your intake needs to be constant. So there is a support system, and every specialty has their own priority. That means a surgeon will look into his surgeon's perspective. But there is a common thing why there are three doctors in this nutrition forum is that patient, if any doubt is there, they will ask the doctor, what should I eat? What should I do? Then the patient's family caretakers, they will have another perspective. There are myths. So definitely prior to surgery, building on nutrition is a collaborative effect. In head and neck, it works. In surgical patients, we have seen post-surgery, there is decline in weight. Probably the nutrition intake is compromised. And that is where, when the patient comes to the doctor, for example, it's a surgery, and wound healing is not happening, and they find a nutrition is not optimum, they will like to check up what is the protein intake, how much proteins are they getting, whether there is a weight loss. In case of radiation patient, intake gets drastically dropped down. So we have seen there is a protocol. We have seen that patients after head and neck, probably there is a 6 weeks of time. So we are expecting the patient post surgery for head and neck to 6 weeks to have a same weight maintain. If the weight is dropping down, we ask them to meet a dietitian, and in our protocol, we are meeting. The patient does meet a dietitian during radiation every week. Post surgery or at the time of discharge, there is a diet plan, and of course there is a dietitian OPD, so they come back with their doubts. We have outstation patients also, online consultation also. So the whole point is the patient should feel connected, the caregiver, patient, because they are already traumatized with the patient's clinical condition, criticalities, the worry. So they need the right person to guide them. So definitely we have seen good results with head and neck, and then GI surgeries, post treatments in CTRTs, chemo, radiation. So you name it, and we can write certain good articles on it.
Hmm. No, it's very uplifting to hear the collaborative and the combined approach that our oncologists and our nutritionists are playing out there for successful outcomes and successful patient treatments. So with this, I'd like to put a last question out for everyone. I'll start with Dr. Rajpal. Dr. Singh, your final key takeaways or pieces of advice to all our audiences, which includes caregivers and the patients, on emphasizing about the public health awareness that we are doing right now about the role of nutrition in cancer. So your message, your piece of advice for all our viewers.
Uh, my advice for this nutrition week is that since we are treating most of the head and neck patient, like 30% of our patient are head and neck patient. So we are evaluating this patient weekly with weight measurements, and moreover, the cast we put on. If it loses, we usually try to see what has happened, why this has gone down, or why this is loose, because usually the cast is actually being done on day one. So if it loses after a week or after 2 weeks, this means there is a drastic weight loss. So we usually consult our dietitians for a nutrition purpose, for high calorie diet or something like that. So as if now I want to say that there is a collaborative approach. It is not individualized for a single doctor, since we are treating patient under a multi-specialty place. So there, wherever it is required, we should consult our dietitian for better management of the patient.
Thank you, Dr. Singh. Moving over to Dr. Jadhav, your key takeaway for all our viewers and take-home advice for the patients, for survivors, for ongoing treatment patients. Over to you, sir.
Yeah, see, the cancer treatment and cancer surveillance basically is a journey, is a long journey. And by having a good nutrition throughout the journey makes everything pleasant, basically, frankly pleasant. At each and every step, it helps for early recovery, for early healing, for prevention of many complications like chemo-induced neutropenia or chemo-induced neuropathies and radiation-induced dermatitis, because that is everything can be prevented by the proper nutrition. And not only during therapy, during surveillance, what my protocol is, see, there are actually guidelines for surveillance. For each and every organ, there is something to do every 3 monthly, 6 monthly, and yearly for coming 2 or 3 years of their follow-up. But along with that surveillance protocol, we should actually monitor their nutritional status also. So just tumor markers and imaging every 3 monthly or 6 monthly for first 3 years is not sufficient as a surveillance. And giving a total health package to them, it is very necessary to have a nutritional support throughout their journey. So not only those imagings and tumor markers is to be actually repeated as per the protocols, there should be a nutritional monitoring also during their surveillance, what I feel. So that's why actually to my patients every 6 monthly I do check up all the vitamins and as well as all the nutritional status very religiously, so that throughout, even it sometimes it helps for your actually prevention of second cancers as well as recurrence.
Right, sir. Right. Thank you for that insightful answer. And I'm sure. Taking a check on their nutritional parameters is obviously going to improve the way that you mentioned. Moving over to Ms. Varsha, your key takeaways and your take-home message for all our viewers here. A message for everyone who has joined us on this National Nutrition Week.
So, my key message is definitely what was my starting answer. Nutrition counseling is important. We look at the ABCD of the patient and we look at the macro and the micronutrients. And at any given point, you should reach out to your team, oncologists, the dietitians, and stay connected, because there is abundance of knowledge and there is no proper insight, or there is no proper evidence on whether it is on the right way or not. Because if you go on, any kind of Google Media or any other thing, they are misled, and that is the right time. This kind of platform helps in connecting to the patient for the nutritional advice.
Thank you, Ms. Varsha, on the insightful answer. Moving over to Dr. Shetty, as we move towards concluding this enlightening discussion, your one piece of advice or a key takeaway that you would like to offer.
So, nutrition is an essential part of human life. Existence is based on nutrition. The problem is we overdo it, right? Where the problem comes. When it comes to overdoing, and if we're going to overdo anything, it's a problem. A lot of attention has to be paid to the nutrition much before a patient ever gets cancer or any of the non-communicable diseases, which everything is related to lifestyle, and lifestyle nutrition being the most important part of it. Especially Now, once the patient gets cancer, after they have gone through the treatment, probably the more important role plays to get back to the society, be more fit, physically fit, take an appropriate nutrition, do not put on weight, watch what you're eating, and probably that is what is going to make the difference. Thank you.
Thank you, Dr. Shetty. So with this, I'd like to bring this panel of discussion to an end, and I'd like to thank all my panelists here, Dr. Shishir Shetty, Dr. Rajpal, Dr. Tushar, and Ms. Varsha. Thank you for spending your time in educating and creating awareness. I'd also like to give a note of thanks to Esperer Nutrition for stepping up with Voice of Healthcare in supporting the cause of raising awareness of nutrition in oncology care. So I thank each one of you. Thank you for stepping up, and I'd like to also thank all the engagement, all the viewers who've stepped up and watched this video. Thank you, and have a good evening.
Thank you very much.
Thank you. Thank you.
Bye.